Hello, everyone, and welcome to ECD Live. I'd like to take this time to turn the floor over to Katie Ham. Katie, the floor is yours.
Thank you so much, and welcome everyone to our first ECD, the latest live webinar. We are so excited to be with you today. My name is Katie Ham. I am the Acting Deputy Assistant Secretary for Early Childhood Development, and I'm pleased to be hosting this meeting today with my colleagues. I'm joining you from my home in Washington, D.C., and the ancestral home of the Piscataway, Nacotchee, and Anacostan people. I'm also really excited to be joining you during Asian American and Pacific Island Heritage Month. And I want to give a special shout out to our colleagues and families in the AAPI community who have joined us today. I am here today with Dr. Bernardine Furchell, who's the director of the Office of Head Start, and two childcare providers, Ms. Maria Isabel Bolivian, and who's the executive director of the Alaka Child Development Center, and Ms. Angie Hicks Maxey, who's the director of the Tiny Tots Child Care Center in Seattle, Washington. You'll hear from all of these folks later on in the presentation. So for those of you who don't know me, I have been in this role for about 3 months. Previously, I was the Vice President for Early Childhood Policy at the Center for American Progress here in DC. And I also worked at the US Office of Management and Budget during the Obama administration. And much, much earlier in my career, I was also working at a child care center, and I volunteered in my local Head Start, as well as an IDEA Part B preschool program for children with disabilities. So I'm just very excited to be here with the early childhood community. We wish we could be with all of you in person, but we're really excited to have 1,500 people who registered for this meeting. We have all 50 states, including DC and Puerto Rico, who are represented. And we just couldn't be more thrilled with the enthusiasm that we see around the country for early childhood right now. We have folks who are grantees, who are from states, national leaders, technical assistance providers, many child care programs, and local Head Start programs with us today. We have started these webinars because part of the Office of Early Childhood's role at the Administration for Children and Families is to engage with all of the folks who make early childhood programs possible. And we want to make sure that we are sharing updates with a broad group of partners and stakeholders and share the latest news about our priorities and initiatives. We're committed to including voices from the field so that you get a chance to hear what is happening from the ground. And so today I'm really lucky to have two providers here with us today. And we see this as an important feedback loop. We want to make sure that we are hearing from you, thanking you for all of your work, and taking your questions. So we'll get to questions and answers later on in our presentation. But to kick us off, I'm just really excited to share with you some of the key accomplishments from the first 100 days of the Biden-Harris administration. We marked our first 100 days in office last week. And this really has just been a moment for childcare, for Head Start, for early childhood development. And we want to just share some of the things that have happened in the first 100 days. The biggest news last month, well, actually 2 months ago in March, the president signed the American Rescue Plan, which included the largest single investment in childcare that our country has ever seen. These funds will support childcare providers while revenue is down and help families afford childcare during this difficult time. The American Rescue Plan provides $39 billion for childcare. Again, the largest ever investment that our country's ever seen. That includes $24 billion for a new childcare stabilization fund, which will provide grants directly to providers to help them weather the financial storm caused by COVID. These funds are now available to states, tribes, and territories. Yesterday, we issued detailed guidance to help all of our grantees get these funds out to providers to build back towards a system of childcare that can meet the needs of children, parents, and providers. We're going to be reviewing the guidance with our Child Care and Development Fund grantees this week to give them support so that they can get this money out to eligible providers as soon as possible. These funds can be used for things like personnel costs. They can be used for facilities maintenance, PPE, equipment and supplies, other goods and services, mental health services for children and employees. They're very broadly available so that childcare providers have the resources they need to weather the COVID-19 pandemic and the recovery. There is also $15 billion in additional funding for the Child Care and Development Fund, which will help parents with the cost of childcare, especially those parents who've experienced unemployment, who've experienced a loss of income and need childcare support to get back to work. And the ARP includes $1 billion for Head Start programs. Dr. Futrell is here to talk to you more about that, but we're very excited to have these additional resources for Head Start to serve the families that rely on them for early education services and all the wonderful supports that Head Start provides to its families and community. During the first 100 days, we also partnered with the CDC on a vaccine campaign to help early childhood educators and teachers during the month of March get vaccines. We developed a comprehensive social media and communications campaign that reached more than 8 million people. And a CDC feedback survey found that 80% of the childcare staff and teachers who responded to the survey got their first shot in the month of March. So we're really excited to see so many people taking advantage of that and recognize that so many early educators have been on the front lines of this pandemic and really wanted to prioritize that in vaccine distribution. Finally, we are working closely across the Administration for Families and HHS as a whole with federal agencies in the Department of Education on implementing an executive order on supporting the reopening and continued operations of schools and early childhood programs. We've been identifying resources such as health and safety guidance for reopening or staying open. We have been looking at things like mental health guidance and the needs of providers, parents, and children during this time. And we'll be advancing some structural changes to promote equity, which is a huge priority for this administration and for the Administration for Children and Families. And we're looking forward to partnering with you as that moves forward. The American Rescue Plan, though, is just the beginning, as well as these kind of initial steps we've taken during the first 100 days. They're designed to respond to the immediate crisis caused by the COVID-19 public health emergency. But we know that long before the pandemic hit, our early childhood systems were in need of investment. We know that early educators in childcare, Head Start, and many preschool programs are chronically underpaid. The high cost of early childhood programs means that many families cannot afford childcare or preschool programs. We know that a lack of public investment meant that Head Start cannot reach all eligible families, especially infants and toddlers. Childcare assistance reach just 1 in 6 eligible families, and only 1/3 of 4-year-olds and a small fraction of 3-year-olds attends public preschool. So the president has proposed, and I want to be really clear, this has not passed Congress. So this is a proposal that the president has put forward that we need to Congress to pass before it will actually become law and resources would get out to states and providers and families. But what the president has proposed is in the American Jobs Plan, $25 billion for childcare and early education infrastructure. This would help things like facilities, supply building. There are also resources for professional development and training for the early childhood workforce. Then there's the American Families Plan. And this plan includes 3 big things for early childhood that I want to make sure everyone is aware of. The first is $225 billion for childcare for children birth to 5. This plan would limit what families pay for childcare to 7% of their income. It would make investments in quality so that early educators and family childcare providers made a minimum wage of $15 per hour and pay parity for those who have the same qualifications as elementary school teachers. It would also ensure that we pay childcare providers based on their actual operating costs and the actual cost of meeting some of the quality benchmarks that they're required to meet. So that would just fundamentally change the way we administer childcare in this country. In addition to the childcare investment, there is a $200 billion proposal for universal preschool for all 3 and 4-year-olds in a mixed delivery system. It would be free to families and available to everyone regardless of income, and families would choose the setting. So that could include a childcare program, it could include Head Start, private preschool, and public schools. And like the childcare proposal, it would make an investment in wages and quality standards. And finally, there is a proposal to invest in the wages, recruitment, and retention of Head Start staff. So the goal is to make sure, regardless of where someone is working, they're still making at least a livable wage. And if they have the same qualifications as elementary school teachers, they're getting the same wage as those teachers. And last but not least, the American Families Plan would expand the Child Independent Care Tax Credit so that families could get up to $8,000 as a tax refund for one child and up to $16,000 claimed for two or more children. So with that, we have an ambitious agenda ahead of us, a lot that we've done in the first 100 days, but I want to turn it over to Dr. Bernadine Futrell. We're very lucky to have Dr. Futrell's leadership in the Office of Head Start. She's had a number of opportunities to talk to Head Start grantees and stakeholders throughout the last several months, but I want her to share more about herself and her vision. So Dr. Futrell, I'll turn it over to you.
Thank you so much, Katie. And we can do this. I know you said it's ambitious, but I know we can do it. And it's been wonderful to be a part and do this work in partnership with you, ECD, OCC. Hello, everybody. It's great to see so many of you online. We're looking forward to this great relationship through these webinars. By way of a background or introduction, I am Dr. Bernadine Futrell, the proud director of the Office of Head Start. And I come by way of being a child in Head Start. I had my first job as an assistant teacher in a Head Start program. And I wrote a book called Connected Leaders. And I think what I wanted to lift up is all of those things together points me to what I truly believe, that we can do more when we come together than we can do on our own. And so we are coming together during this webinar at such a significant moment in time for us that it's just remarkable. So I thank all of you for being a part of this early childhood education village about what it takes to be effective, to have family-centered practices, and to really help move ahead the work that is in front of us. And it's such a momentous opportunity. My role here, I'm on day 78 and very proud to have been doing great work. I do want to give a great shout out and credit to the amazing team at OHS, our amazing leadership and our Deputy Director, Ann, as well as many other leaders at the Office of Head Start, who since day one of President Biden and Harris's administration has really hit the ground running, thinking about ways to connect, extend, and expand upon the president's agenda and ideas about what it will take for our country to build back better and stronger. So I want to thank our team at OHS, and I want to lift up, while I have the time, about 5 key things that we've been doing here at the Office of Head Start since the first 100 days. These are kind of the top 5 Head Start updates, and I'll share them with you. And the first I will say is we are prioritizing relationships and learning from others, learning from the Head Start community and learning from each other. I have been on what we are calling our listening, learning, and leading tour, where I've been virtually meeting with Head Start grantees, Head Start programs, meeting with the wonderful OHS team individually in groups across the various regions, even stakeholders like many of you who are on this line, to really talk about where we can start and what we have so we can build upon it as we learn and look towards the future. I am so honored that many of you and many other people have spent the time to have these conversations and the opportunities. And so what I will lift up now, just from this listening, learning, and leading tour so far, there are 3 areas that we're going to look to focus, at least for the next 100 days. And the first one, I know it's on everybody's mind, and that's moving Head Start forward and getting back to in-person comprehensive services. More on that to come. But what I want you to know is we see getting back to in-person comprehensive services as the work of right now for our Head Start community. And in order to do that and to do it effectively, we're going to do it together. So we're going to have this campaign, we're going to have webinars, we're going to have opportunities to engage directly and to hear from you and learn from you also about what you're hearing and learning and hearing from programs across the country so that we can move together towards that back in-person comprehensive services. So that is our Head Start Forward campaign. It launches one day after Head Start's birthday, which is next week. So mark the calendar and just connect with us on that hashtag as you see that information coming out. The second priority, and Katie mentioned this, and I want to double down on it, is equity. We are focusing on equity from including, racial equity, economic equity, health equity. We learned a lot about ourselves during this pandemic, but we also know a lot from our history of being founded out of the civil rights movement and all of the opportunities that Head Start has to really be equity levers in communities. And so we're proud to anchor in that work, and we invite you to continue conversations with us about that work. And the third priority coming out of the listening, learning, and leading is building partnerships with families. We want to focus on partnering with the needs and what's happening in communities with families. We look at our work as a unified Head Start that includes early Head Start, migrant seasonal Head Start, American Indian, Alaska Native Head Start child care partnerships. All of those programs, from the way we see it, are designed to support the unique needs and opportunities to partner with children and families. And so we're going to center our work on that. And that's number one, our listening, learning, and leading tour. Number two, we are working with the ACF leadership and others to really support and advance the key priorities of the president's administration. And that includes our executive orders. In particular, we're focused on the racial equity executive order. And our team has a lot of great resources and things that we're starting to create, but we're going to amplify and continue that work. So we're going to lead within the Office of Head Start, but we're also looking at what we know and what we can offer to the broader conversation around racial equity. Number three, just like with OCC and ECD, we have been very focused on getting information out about the COVID-19 vaccine. We know that it will save lives, and we know that it also reduces the risk of people going to the hospital with the virus. So we are doing everything that we can to get that information out, knowing that our community was hit significantly hard with this virus, with the Head Start community, our frontline workers. So in addition to what Katie had mentioned, we're very proud, I would say, to have Head Start included in the president's directive around prioritizing the Head Start workforce with the vaccines. We've held various webinars with the CDC, with HRSA and others. We held the webinars not only just to get the information out about the vaccine, but we wanted to move the conversation beyond vaccine hesitancy when we start talking about equity. And so we feel good that we've had a lot of engagement from the Head Start community, as well as in partnership with the CDC and other medical and the scientific community, to really start talking about what it takes to have equitable access to a vaccine and how you can lift that up in the community. And then also bolstering our Head Start community as health equity leaders in their community. So we appreciate that. That conversation is still going on because we have many more people that should be vaccinated pretty soon. And so we've launched and we're continuing to support our Sleeves Up for Head Start vaccine campaign that we hope you can follow along and add your selfie when you get your vaccine as well. Number four, this is the conversation of right now. The conversation of right now is how do we take what we've learned throughout 2020 and 2021 and apply it in a new, innovative way towards the work that we get to do moving forward. And I know we all have ideas and thoughts, but it's hard to do that without the resources. So we are proud and excited about so many of the resources that are coming, and we're working very fast to get those out. We have already awarded to the programs the $250 million from the Consolidated Appropriations Act, and that's already available to programs. We are also prioritizing getting out the $1 billion from the American Rescue Plan. We expect to get that out no later than the end of the summer, but we're moving very fast. But what you should know is that those applications are open now. They close on the 18th, and we're moving very fast to get that information out. And we're also wrapping it around with information and webinars and conversations that we're having about what the opportunities are. And they're kind of three when we think about these resources. There is the obvious, getting your facilities back in order and in a place where people can be safe and you can limit the spread of the virus. That's important. But what I would say the two most important that we're thinking about with these funds is one, reaching and supporting and connecting with more children and families. That means, finding the children and families that programs have been funded for, and also thinking about different ways to engage summer programming, thinking about the opportunities ahead for those children that may have missed out on a year or so of Head Start. And then the second area, or the priority area, is our Head Start workforce. Katie mentioned it, and we're very proud of the inclusion of Head Start in the American Family Plan as related to the workforce compensation. And we also want to prioritize the wellness of our workforce. So we are encouraging Head Start grantees to think about what's different about the roles and the jobs that we had before the pandemic that maybe mean we should do things a little bit different. Is there an opportunity to change the load for a family service worker? Do you have some benefits or opportunities to bring in teams to do some professional learning around anti-bias practices? All of those things, we really want programs to think about it, because we know in order to get back to in-person comprehensive services, we have to start with what I call our people. We have to start with our people ourselves to make sure that we provide the support and the resources that we can. And again, our getting that money out and moving that forward, that's kind of our number one priority, but that's going to be the top 5. And when I say the funds are going to be out and the applications are coming, that's what we're looking for. So again, our top 5 for Head Start: listening, learning, and leading, inviting you to those conversations, working with the leadership to advance the president's priorities, looking at getting everybody vaccinated, because we know that's life-saving. And number 4 is working with the community to really support innovation. And number 5 is moving fast as an office to get the resources to the local programs in the communities. I am so excited about this, and I know there's more work ahead, but I thank you all again for being a part of this conversation and helping to move and support our early childhood and education village. Thank you.
Thank you so much, Dr. Futrell. That was a great overview of all the exciting things that Head Start has in the pipeline. I am excited now to turn the conversation over to Ms. Maria Isabel Bolivian. Isabel is the Executive Director of the Alaka Child Development Center, an NAEYC accredited program that serves more than 200 children in Fairfax County, Virginia. She has over 25 years experience in early childhood education. She also recently had the opportunity to introduce the Vice President when she announced the funding awards to states in the American Rescue Act plan, when the $39 billion went out to states, tribes, and territories. And she was also a virtual guest of the First Ladies at the joint address to Congress at the end of April. So Isabel, I'm going to turn it over to you to talk more about what some of these initiatives mean to you, and to give us a little bit more information about what your experiences have been like lately, introducing the Vice President and interacting with some of the leaders in this administration. Thanks so much for being here.
Thank you, Kathy, and thank you for the invitation and to join you and other colleagues from around the country. I began my early childhood education career 25 years ago, convinced that I could make a positive impact in the lives of young children. And as time passed, I realized that we need to ensure that those who care for children are well supported, trained, and compensated. We all know the benefits of high quality early education, but we often forget its high cost. A program that offers quality environments, both indoors and outdoors, low teacher ratios, and qualified early childhood professionals required significant resources, and this financial burden only got bigger during the pandemic. Programs that provide high quality often do it at the expense of childcare educators. We have been paying the price of quality with low wages, little training, and lack of benefits. Often, early childhood education teachers have second jobs only to make ends meet. At Alaka, we're lucky to have an engaged and supportive stakeholders and community, starting with our amazing staff and broader community. Prior to COVID-19, this support allowed us to provide ongoing high-quality care and instruction. But before the pandemic, our program had an occupational therapist, a speech pathologist, a mental health consultant, music and art teachers. Also, we partner with nursing schools, physicians, and social workers. All of this allowed us to provide equitable access for children, including kids with special needs. But these services were eliminated or reduced due to COVID-19. When the pandemic hit and everything closed, we knew that our children needed for us to remain open. Since many of their parents were frontline workers, we also knew that if we closed, we would probably be closing permanently. Thus, we could not take that chance. Fred Rogers once said, "We live in a world in which we need to share responsibility. It is easy to say, it's not my child, not my community, not my world, and not my problem. Then there are those who see the need and respond. I consider those people my heroes." At Alaka, we decided to respond, but we realized that we could not meet the challenge alone. So we reached out to the community at large, starting with Virginia's governor and first lady, local government, the private sector, and foundations, as well as hundreds of volunteers and 27 churches that make up ACA. And yes, the administration approved a PPP loan, which was recently forgiven. In short, we took all on hands on deck approach, thinking outside of the box, and it worked. For the first time in my career, I see that early childhood is not only achieving the spotlight it deserves, but it's also gaining access to the funding that will allow us to do the job right. When I was invited to the White House to introduce Vice President Harris, I felt that everything we have been working for was worth it. Like I said then, I stand on the shoulders of hundreds and thousands of providers who have decided to be there for children and their families. Now, it is nice to see that the federal government gets it too. I believe the work is just beginning. We need to be at the table to ensure decisions are made in the best interest of children, parents, and early childhood professionals. This year's increased federal funding to enhance childcare services is already making a positive difference in the lives of children and families we serve. Parents will be able to return to work knowing full well that their children are attending affordable, high-quality programs like ACA. Furthermore, the federal funding is offering much-needed relief to families by waiving the parents' portion of the cost of childcare, providing access to childcare for families while they look for work, increasing the household income eligibility limits so that parents are in a better position to qualify for childcare subsidies, delivering direct stabilization grants to program open and paying for personal protective equipment so that teachers are safe. I am sure you will agree that ECE investment is a national security and an economic imperative. If America is to continue to lead the world, it needs a well-educated, healthy, and resilient workforce. And this begins with infants, toddlers, and preschoolers. Moreover, high-quality early childhood depends on early childhood educators who are well-trained, well-compensated, and technologically able. This is what we're doing at ACA. We're investing in our professional development and improved wages of our teachers, recognizing their skills as essential workers, and we're ensuring that children have equitable access to high-quality care. Thank you.
Thank you so much, Isabel. Really appreciate your comments and your sharing your experience. I want to next turn to Angie Hicks Maxey, who's the director of Tiny Tots Childcare Center in Seattle, Washington. As some of you might know, Washington was one of the first states to announce how they plan to use their American Rescue Plan Act funding, and they're going to be using some of those resources to increase staff wages and provide health insurance. Angie is the CEO of Tiny Tots Child Development Center, Tiny Tots Development Center and Early Learning, an out-of-school time agency founded in 1969. They have 5 locations caring for children from birth to age 13. And they have 99 preschool students through a contract with the state of Washington. And they also run a program that is based off of the Head Start standards to provide high quality early learning and care. Angie is the second generation CEO. The business was founded by her mother, Helen. So Angie, we are really excited to have you with us today. Take it away.
Thank you so much. And thank you, Maria. That was an excellent overview that you, I have nothing to add other than what you talked about, the need for the compensation. You did an excellent job. I just want you for a moment to imagine turning on the news and hearing the breaking news that public schools were closed, the businesses downtown were closed, but childcare was magically asked to stay open. I was a nervous wreck, of course, not understanding what was going on. But within a moment's notice, we went from childcare provider educators to becoming essential workers without any real guidance. The only saving grace was the skilled professionals that work in this field. We leaned in and reflected upon all of our past training and our policies and procedures that had always guided us. So therefore, we kind of knew what to do. We were experts in the field that we were in. We were already a clean environment and we have many cleaning protocols. So we just decided to say, we'll double down on those. We didn't get any real guidance about what to do with COVID for about 3 to 4 weeks after we were open. So we took out all of our rugs, all the dramatic play clothes, even books. Anything that we couldn't wipe down with a cleaning solution was out. We still currently have cute little separated play areas that are 6 feet apart for our children to play in because we took all of our rules literal. To date, we've had no COVID transmission, and we are so thankful for that. We had to become very resourceful this past year. We had to ask parents to help buy toilet paper, eggs, even bleach when things were running low. We had to go to Costco and go in and buy one bleach, go out to the parking lot, go back in and buy another bleach. Wild times. But those were items that we needed that were vital for the health of our programs. If there's anything that we've learned, this is an area I think that we can improve upon. We should have some strategic storage of supplies for childcare, just like they do for hospitals. We should not have to fight for cleaning supplies and for eggs and for milk, and we're an essential field that needs to be open. So that was really stressful. The other thing that I want to talk about is that we took cleaning seriously. We've already done it anyway, but we were like, okay, we're gonna do a strategic cleaning schedule with one person that's rotating behind the other person. We had checkoff lists. We took it very, very seriously. Our staff, though, were scared. Many of them did not want to come to work. And of course, I understood that because nobody really knew how COVID operated in the beginning. We didn't know how we could get it. We didn't know if it was on your shoes, if it was in the air. We were just like sitting ducks. So the staff that did say that they were going to stay and work with us, we did our best to provide for them a $2 increase. And we bought lunch for everybody for 3 months because we told them they couldn't leave. When they came to work, we said, you got to stay in the building. We don't want you leaving and going. So stay here. We'll bring the lunch to you. I mean, they were scary times. Just think about it. We're better now. But a year ago, it was a mess. We created Tiny Tots TV to do remote learning on our own. Nobody told us how to do that. I'm so proud of all the providers that had to jump in and figure out how to do remote learning. We got on Zooms and figured out how to do lesson plans for our students and all of that. And amazingly, a lot of our students are really keeping pace. One of the things that I think is a byproduct of this is we became much closer to our parents because we got a chance to see them by Zoom. They couldn't run away and say they couldn't come to the parent meeting because we're like, we know you're at home. So that was kind of fun. We were able to get with them. We even implemented procedures for our staff help. We changed out of our street clothes and changed into scrubs and inside shoes. And then we changed back so that they didn't have cross-contamination taking it home. We were trying to think about their safety as well. I am thankful to the state of Washington and the Department of Early Learning who allowed us to maintain our paid enrollment from March through August. Paying for those students on the roll allowed us to budget, give us a sense of peace, and even allow parents to know if they wanted to bring them in, if they felt comfortable. If they didn't have to worry about the fact that we weren't going to have income. That was very, very beneficial. The PPP loans were beneficial, and the one-time small grants that the state allowed us to get, they were easy to apply for, and they were very necessary. I'm also thankful to USDA, who gave us different waivers because we couldn't always maintain our menus because we couldn't purchase the food. So we're appreciative of them as well. It's been a wild ride, but as I look back on it now, I'm very thankful that we had standards and procedures in the field that we work in. Although we complain a lot about our procedures and our policies, they really served us well because we were able to lean on things that we knew to do right, and we put them in force. And when we needed to implement our own policies and procedures around things that were new for COVID, we had something to lean on. So all I have to say is that this has been a time of reckoning, that we understand that our staff are the most important resource. And if we can do anything, funds should go more directed to the staff. Thank you.
Thank you so much, Angie. Really appreciate both of you being here and providing your perspective with us today. Thanks so much. I want to turn now to our Q&A. We invited all participants to submit questions ahead of time, and we went through and kind of selected those that had that were coming up again and again so that we could answer them here today. If we don't get to your question, we will try to answer it in another forum. But I wanted to start with a question from Florida, which is, when will the guidance to states be released on the use of ARP childcare funding? So the childcare stabilization guidance was released yesterday. That's for the $24 billion in childcare stabilization funds that will go as subgrants to childcare providers. That is linked in the chat. And then the childcare supplement, the CCDBG supplemental funding, the $15 billion. We are hoping to get that guidance out as soon as possible, but we're probably looking at another few weeks before we can release that. Our second question is from a Head Start grantee in Pennsylvania. When will the process or grant application be released for the ARP Head Start funding? And does the due date allow for review and approval? Dr. Futrell, do you want to take that question?
Thank you. Yes, absolutely. And kudos to Ms. Maria and Angie. Great job. I appreciate it. So for Head Start, we did release and open up applications on May 4th for the ARP funding, and it closes on May 18th. So we are encouraging grantees to, if you can, work with your parent councils and your boards, but it's not needed because we want to get the funds out and the resources, and we want you to do it in partnership. And so the window there, again, May 4th, it's been open and it's going to close next Tuesday, the 18th. Thank you.
Great, and we have a question about what childcare providers need now that the guidance is out, the funds are with states. What do childcare providers need to be sure that they can access the funding and learn more about these resources that are available? So I'll look to Isabella and or Angie if you want to answer that question.
Well, to begin with, I think that we need to understand where providers stand right now. They are overworked and they're really limited with resources. So what I hope happens with this funding is that it goes to them, it goes in a streamlined process, it goes in a way in which they don't have to jump through hoops to get it. It's important that everybody that works with children has access to these funds, and that the application process is simple and it's available in multiple languages, and that the requirements to complete applications is not so burdened that those that do not have access to technology or speak another language have trouble getting them.
Agreed totally. In Washington, they gave out some one-time grants for us, and the process was super easy, which, like you said, Maria, took a load off of our mind. because we are stressed all the way out and stretched really thin. So it was simple. It was a click, a click, a click. They knew who we were already because we're in the system, and the funds were easy to be sent. So everybody that was already in the system, that was a part of the licensing procedure, was able to easily apply for those funds. And that made it really simple. And we want to make sure that it is easy because we have so many other priorities right now. That's not one that we want to be loaded down with. And I, again, also agree that we need to make sure we look out for multiple languages. And if there are complications, that there is a way for those people that need additional resources, they have some place easily to go to that they already know. Don't create a new barrier for them. Create a system where they already know to go to and get that help.
The last thing I think that is worth adding is having the ability to use these funds with our discretion, because different programs need different things. And when we're limited as to, oh, these funds you can spend on this or that, then we struggle having really meeting the needs of our programs and our children and our families.
Thanks to
I
you
would
both.
agree. I would agree. Flexibility is the key. And I guess I could just say, for example, the PPP was kind of like that. It was, salaries, but it was also, your utilities, your rent, your this, whatever. It was a lot of different categories. So as long as it encompasses a lot of categories of what we use, and especially around supplies, bleach is 4 times more expensive than what it was, bleach. And so, we're still getting the same allocation, but our supplies have gone up like 4 times. So we definitely need these funds, and we need them as soon as possible. So that's the other thing I want to say is don't hold them up with a bunch of bureaucratic, systems in there. Get these funds out.
Thank you so much. It's really helpful to hear from you both, and would just echo, it needs to be simple, streamlined, and quick to get to providers. So appreciate that message. Our fourth question is from Georgia. Will there be a renewed focus on professionalizing the infant toddler workforce through pay and credentialing requirements? Asking about the early Head Start childcare partnership models and making sure that those early educators are included. Once a preschool teaching staff position opens and becomes available, they're concerned that people often leave the early Head Start position for higher pay and better working conditions. Dr. Futrell, do you want to address that?
Yes, and thank you, Katie. I think that question outlines a lot of the topics that we are focused greatly on at the Office of Head Start. It is so important to really not only support our workforce, but to create conditions where we have longevity and we are able to create those relationships and have those connections. So as we are working and thinking about that, we are very excited that the president included in the American Families Plan, an opportunity potentially for Head Start to have pay parity with other people that are doing similar work. I know the work of Head Start is unique and different, but we do appreciate that conversation starting there and then also the conversation around moving the wages towards $15 an hour. I know it's kind of a one opportunity here, but I think the bigger space is to continue to have these conversations. And so for the Office of Head Start, we're very excited and energized by this kind of bold action from the president, and we stand ready to support and identify ways that we can move it ahead. And again, it's in the American Families Plan, so it's an idea and it has to get passed and moved throughout the different channels, but we are very hopeful and we're continuing to have those conversations that you outlined as well. Thank you.
Thank you so much. And then our last question today is about pre-K, specifically about the president's proposal on universal pre-K for 3 and 4-year-olds and how it will take into account infants and toddlers. There's also, we have a couple questions about whether the preschool program is in fact mixed delivery, and some questions or different information that people have seen in different places. So this is a great question, and I really want to be clear on what the president has proposed. There are two proposals that are on the table. One is an expansion of childcare for children birth to 5, and that is a program that will occur in the childcare settings that exist today, family childcare homes, childcare centers, and it will be broadly available to low-income and middle-class families who need help paying for childcare. Second, there is a preschool proposal that is targeted to 3 and 4-year-old children, and that is designed to provide universal access. So it's not means tested. Any family that wants to participate in preschool would have the opportunity to do that. And that program is also a mixed delivery model. So it would allow childcare programs that serve 3 and 4-year-olds and want to be part of the preschool program to be a provider. It would also allow Head Start and would allow private preschool programs and public schools to be part of it. So it's affirmatively mixed delivery preschool that the president has proposed. And then the preschool program has been, I would say, more of a focus in the media, but want to be clear, there's also a childcare investment that would serve infants and toddlers and would recognize the high costs and the needs that families with very young children have. Well, thank you all for your questions. We really appreciate the dialogue and the thought that you all put into them. We will be doing this every month. So we are at the second Tuesday of every month, we have a webinar on the calendar to give you all updates, to hear from the field. We hope you'll join us. You can join us by signing up for the ECD newsletter. You can go on Twitter, it's at ECDGov, and let us know what topics you want to talk about, or see more information. Follow that Twitter handle to learn how to sign up for the webinar in June. But we're hoping to be engaging with you and talking to you going forward, to have this back and forth and be able to share what the administration is doing and what you can expect. So I want to thank Isabel, Angie, and Dr. Frischel for joining me. Thanks to all of you for taking the time to engage with us, and we'll look forward to talking to you next month.